Mr. President, I rise here today because the state of Florida has again proposed to harm thousands of seniors and folks with disabilities who rely on Medicaid for their health care as well as their financial security. Under current law, critical protections in Medicaid allow those who rely on the program for their health care, they can get up to 3 months of retroactive coverage after they apply for Medicaid after the time that they have enrolled in the program. To put that another way, a person who has had health care problems and that is eligible under Medicaid, once they apply, under current law, there's a look-back period of 3 months that those health care expenses that they incurred would be reimbursed to their health care providers, the doctors, the nurses, whatever the service is, and paid by Medicaid because they've been deemed to be eligible. Certain people with disabilities and certain people because of their income level and their status. Now, what the state of Florida is proposing, and this is what is so damaging, is to cut that 3 months of reimbursement for Medicaid down to 1 month. Well, the current law is 3 months. So why should the state of Florida penalize its citizens that are getting their health care? They're eligible under Florida's law for health care through Medicaid. Why should you penalize them by saying, we're only going to make you eligible for 30 days instead of 3 months? It defies understanding. The state proposed to CMS just a week or so ago to eliminate this critical protection, and in the process, it jeopardizes how many people in Florida right now? 39,000 of the most vulnerable Floridians and the countless medical providers who treat them. So, if they constrict this period, that means a lot of people are not getting compensated by Medicaid, such as a hospital. The hospital can't eat all of those uncompensated expenses. And so what happens? Ultimately, that finds its way into all the rest of us taxpayers who also have private health insurance, and it runs the price of the health insurance up. And if this is not enough of an outrage that the state of Florida is doing to these 39,000 people, this maneuver will also cut up to $100 million from an already underfunded Medicaid program that is suffering because the state of Florida has already decided over the last several years that it's not going to expand Medicaid up to 138% of poverty. And you know how much money that they have passed up, the state of Florida has passed up, that otherwise 800,000 people in Florida would be getting health care through Medicaid? They passed up $66 billion in federal funds that is sitting there on the shelf ready to be used for health care through Medicaid for Florida by refusing to expand Medicaid that is allowed under the law up to 138% of poverty. Well, it's just unacceptable. This provision was designed to protect seniors and veterans and pregnant women and individuals with disabilities and parents and their families with high medical bills and the cost associated with the long-term care. So not only are you jeopardizing the hospitals and the doctors and the nurses and all the medical providers of not getting paid, of which they are eligible under current law, you're also putting into financial jeopardy the poor people that are sick that need to be treated, and they don't have the money because of their income level. They don't have the money, and then you start getting all these dunning statements and saying, we're coming after you financially and we're going to take you into the poorhouse. And so that's why I joined with my colleague in the House, Congresswoman Castor, and we have a letter signed by half the Florida delegation calling on CMS to reject this heinous provision that the state of Florida is asking for. And Mr. President, I ask consent that this be inserted in the record.
Without objection.
So it's our duty to ensure that the folks, the people in our states have access to care without having to go into debt to obtain that care. And the state of Florida is attempting to take that away. And in doing so, it's attempting to wipe out many families' pocketbooks and increase the strain on the health care providers, the doctors, the nurses, the hospitals, and all Florida taxpayers who ultimately, on uncompensated care, are the ones that pick up the bill. The state of Florida claims that this proposal will, quote, enhance fiscal predictability, end of quote. That begs the question, for whom? If the state really wanted to secure greater financial security, they would expand Medicaid and accept the $66 billion of our Florida financial taxpayer money sitting on the shelf that Floridians have already paid for with their tax dollars and provide health care to up to 800,000 Floridians that don't have it now. And perhaps what's even more troubling is that the letter accompanying the state of Florida's request stated the agency, get this, quote, was not aware of any concern or opposition raised by any member of either party regarding this provision during extensive budget debate, end of quote. So now it's not only is the state of Florida trying to harm thousands of Floridians, including many of our seniors and veterans. By the way, veterans are on the Medicaid program as well. Don't forget that. Veterans are not just all taken care of under the Veterans Administration. There are a lot of veterans on Medicaid. So the state is trying to harm these people. And I wonder now, in that letter that I just quoted from, if the state is misleading the federal agency, CMS, in trying to get their waiver approved to cut from 90 days down to 30 days. Indeed, members of the Florida Senate, the Florida State Senate, the legislature, raised innumerable concerns and objections to the provision. Most recently, the Florida Senate Minority Leader called out the governor's administration for the misleading claims. And instead of making it harder to gain coverage, we ought to be focusing on getting our uninsured neighbors quality and affordable health coverage and reducing uninsured, uncompensated cost. We need to do what's good for the people of Florida. Mr. President, I yield the floor.